Hey there, viewers! Small intestine cancer is a rare disease where cells in the tissue of your small intestine change. They grow out of control and can form a mass or tumor. The main job of the small intestine is to break down and absorb food, fats, vitamins, and other substances your body needs. If you have this type of cancer, tumor cells may block the small intestine. These tumors may block the flow of food and affect digestion. As the tumor gets bigger, the blockages may cause pain in the abdomen. A slowly bleeding tumor may lead to anemia. An obstruction, when the flow of food is completely blocked, may cause intense pain, nausea, vomiting, and typically requires immediate surgery. In general, intestinal cancer symptoms are often vague and difficult to diagnose, but there are certain signs that may indicate intestinal cancer. In today's video, we'll tell you what these signs are, from change in stool frequency, bowel habits, fatigue, weakness, abdominal pain, and more. Watch till the end to learn about all of them. Number 1. Changes in bowel habits. Every now and then, we all experience changes in our bowels. We may experience diarrhea or constipation due to something we ate or due to being sick with something like the flu. But changes in bowel habits that continue may indicate a more serious condition. If you experience diarrhea or constipation that lasts for more than a few weeks, you need to talk to your doctor. Another change in bowel habits that may indicate intestinal cancer is having thin or narrow stools. These are often described as ribbon or pencil-like and may also be a sign of intestinal cancer. In an otherwise healthy person, thin stools may be caused by narrowing of the colon, also called a partial blockage. Think of your colon as a hollow tube, like a drinking straw. If a tumor is growing inside the colon, it can start to obstruct the flow of stool through it, just like a pea inside a drinking straw would block or slow the flow of fluids. Number 2. Change in stool frequency. A persistent change for more than a few days in stool frequency is one potential sign of intestinal cancer. So, for example, if it's normal for a person to have 3 bowel movements per day and they're having only 1 per day or 1 every other day, this may signal constipation. On the other hand, another person's typical bowel pattern may be to have a bowel movement every other day. In this case, having 1 bowel movement per day may be unusually frequent and may signal something more serious. Enjoying this list so far? Well, keep watching because there's a lot more good stuff coming up. But before moving on, don't forget to subscribe to our channel for more amazing videos like this and hit the bell icon so that you don't miss any updates. Number 3. Changes in stool color. Bleeding in the colon due to cancer may result in bright red or dark red blood in the stools. More specifically, if bleeding is in the ascending or right side colon, the stool may be more maroon or purple in color since the bleeding is occurring further away from the rectum. If the tumor is in the descending or left side colon, the bleeding tends to result in bright red stool. You will also have a persistent feeling that you need to have a bowel movement even when you just had one. Number 4. Weight loss for no known reason. If you experience rapid or unintended weight loss, this may be a sign of cancer. In patients with cancer, weight loss is often the result of cancer cells consuming the body's energy as they multiply. In addition, your immune system is also spending more energy to fight and destroy cancer cells. If intestinal cancer is the specific cause of your weight loss, this may be due to the tumor blocking the colon or intestinal tract, preventing proper nutrient absorption. Number 5. Fatigue and weakness. It can be easy to confuse fatigue with simply being tired. Between work and personal obligations, everyone can feel run down. If the exhaustion does not go away with rest, it could be fatigue. In addition to intestinal cancer, fatigue and weakness could also be symptoms of diabetes, anemia, and heart disease. Similar to unexplained weight loss, cancer cells cause fatigue as they use up your body's energy. Sometimes cancer of the intestine can cause fatigue due to internal blood loss. In many cases, the symptoms of intestinal cancer are connected. Other cancer symptoms, such as unintentional weight loss and a change in bowel habits, can also increase the feeling of weakness. Number 6. Abdominal pain. Almost everyone experiences abdominal pain, bloating, or cramps at some point in their life. Most of the time, it's not caused by a serious condition, and the severity of your pain does not necessarily reflect the seriousness of the condition. However, if you experience any amount of abdominal pain that is unfamiliar, you should talk to your doctor. They may have a simple solution to your pain, or further testing to diagnose a more serious cause may be recommended. Be sure to listen to your body and recognize when something doesn't feel quite right. Number 7. Unexplained anemia. Anemia refers to a lowering of the red blood cell count. In terms of intestinal cancer, anemia may be caused by a microscopic amount of chronic blood loss in the stool. In this case, iron is lost with the red blood cells and can slowly deplete the total body stores of iron. The production of new red blood cells is reduced and eventually the total red blood cell count decreases, causing anemia. Anemia can also cause fatigue because the red blood cells are responsible for delivering oxygen to the body tissues. In women, an iron deficiency is commonly seen during menstruation. However, for men, iron deficiency is uncommon and needs to be further investigated by a physician. Number 8. Vomiting. Vomiting can be caused by a number of normal occurrences, such as motion sickness, a virus, or unpleasant sights or smells. But if nausea and vomiting are accompanied by other symptoms, such as constipation or pain, intestinal cancer could be the cause. When vomiting is a symptom of intestinal cancer, it's usually because a tumor is causing a bowel obstruction. Depending on the severity of the blockage, solids, liquids, and even gas may be prevented from passing through the colon. This can lead to painful stomach cramps and constipation. Either of these symptoms can result in nausea and vomiting. So now that you know all about the signs and symptoms of intestinal cancer, the question on your mind must be, how can you treat this cancer? Well, here are a few options. Number 1. Surgery. Surgery is the most common treatment of intestinal cancer. The first type of surgery that may be performed is resection. This surgery is done to remove part or all of the organ that contains cancer. The resection may include the small intestine and nearby organs if the cancer has spread. The doctor may remove the section of the small intestine that contains cancer and perform an anastomosis, which is joining the cut ends of the intestine together. The second type of surgery that may be performed is bypass surgery. This surgery is done to allow food in the small intestine to go around and bypass a tumor that is blocking the intestine but cannot be removed. After the doctor removes all the cancer that can be seen at the time of the surgery, some patients may be given radiation therapy after surgery to kill any cancer cells that are left. Treatment given after the surgery to lower the risk that the cancer will come back is called adjuvant therapy. Number 2. Radiation therapy. Radiation therapy is a cancer treatment that uses high-energy X-rays or other types of radiation to kill cancer cells or keep them from growing. External radiation therapy uses a medicine outside of the body to send radiation towards the cancer. Another type of radiation therapy is internal radiation therapy, which uses radioactive substance sealed in needles, seeds, wires, or catheters that are placed directly into or near the cancer. The way the radiation therapy is given depends on the type of cancer being treated. External radiation therapy is used to treat small intestine cancer. Number 3. Chemotherapy. Chemotherapy is a cancer treatment that uses drugs to stop the growth of cancer cells, either by killing the cells or by stopping them from dividing. When chemotherapy is taken by mouth or injected into a vein or muscle, the drugs enter the bloodstream and can reach cancer cells throughout the body. This is called systemic chemotherapy. When chemotherapy is placed directly into the cerebrospinal fluid, an organ, or a body cavity such as the abdomen, the drugs mainly affect cancer cells in those areas, and it is called regional chemotherapy. The way the chemotherapy is given depends on the type and stage of cancer being treated. Have you ever had a cancer scare? Did it include any of the symptoms that we mentioned? Let us know in the comments section below. Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait! What kind of bestie are we if we don't tell you about our other awesome videos? Go ahead, choose the left or right video, and enjoy.